Hello and welcome to the Medical Sales Podcast, and I am your host, Samuel. In this podcast, I interview top medical sales reps and leading medical sales executives across the entire country. And it doesn't matter what medical sales industry, from medical device to pharmaceutical to genetic testing to diagnostic lab, you name it. You will learn how to either break into the industry, be a top 5% performer within your role in sales, or climb the corporate ladder. Welcome to the Medical Sales Podcast. Hello and welcome to the Medical Sales Podcast. Today I have a treat. Today I'm going to share the story and have the interview with one of our students, Keila Resto. This is just a fantastic story to share. Keila was a professional in a lab setting, and she was a lab manager that wanted to get into medical sales. And, you know what? I'm not even going to try to do it any justice because I can't. The story is too good. It needs to come from her. So make sure you're tuned in, because if you're wanting to get into medical sales, if you've been in a position anywhere near hers, or you even sound like what you're about to hear, then take note, because the results that she was able to experience can be the results that you can too. So tune in, listen up. If you want to get into medical sales, this is an episode you absolutely have to listen to. And I'm not going to say any more. So without further ado, thank you for listening to the Medical Sales Podcast. And I really do hope you enjoy this interview. Hey, Keila, how are we doing today?
I'm doing great, Samuel. How are you doing?
I am fantastic. Absolutely no complaints.
Awesome.
Why don't you tell us who you are and what you do?
My name is Keila, and I'm currently an associate clinical account specialist at Biosense Webster, one of the many companies of Johnson & Johnson.
Okay. Clinical account specialist at Biosense Webster. So talk to us about the role. What is your specific role? What do you do on a daily basis?
So we essentially help the electrophysiologist and the entire EP staff from start to finish perform cardiac ablations to treat different cardiac arrhythmias.
Ooh, okay. I love this is the fun stuff. So let's explain to the audience, what exactly is the role of electrophysiologist? Where do they fit in medicine?
So electrophysiologists are highly specialized cardiologists. So by specializing in electrophysiology, they're specializing in basically all of the electrical network of the heart, if you will. And they treat, so then they'll treat people with arrhythmias, either with drugs or with minimally invasive procedures like cardiac ablations.
Awesome. And I'm so excited to have you here talking about this today, because you are one of the graduates from the Medical Sales Career Builder program.
I am.
So, for you to be in this role and to get it through our program is an amazing thing. But let's get a little bit more into what you do. So yes. Are you responsible for selling? Are you brought in after they're already sold onto the products? So talk to us a little bit about where you fit.
This role is actually very interesting because it's a blend of both. So you have like the capital side of it, which is like the entire like software component, like getting the Cardo 3 system into the lab. And then you have all of I call them like the smaller components, or like the disposables, consumables, which is like the catheters that are used on a daily basis. And so the role of the clinical account specialist, going for it, I'll just call it a CAS. That's wordy. And so our job is to, make sure that the cases happen, because what is very special to this role is that a case cannot happen without a CAS essentially like co-piloting the procedure from our workstation. And so we're involved in not necessarily acquiring the new account, that's more high level, but then maintaining the ongoing relationship, and also essentially building that level of trust with the physicians and with the purchasing groups, so that they can then try out our new products or like service agreements and things like that. So our job is to keep it flowing and introduce the new technology.
So you're more on the utilization side of things.
Yes.
Okay. Now you mentioned workstation. What do you mean by that?
So our workstation is comprised of our computer and the patient interface unit, which is the unit that connects all the cables to the catheters and a radio frequency generator. And so all of those things interface together and essentially come together on our Carto 3 software from our workstation and allows us then to create a 3D electroanatomical map. And by electroanatomical, I mean anatomical, meaning the actual anatomy of the chamber that the doctor's in, but it's being built by reading electrograms.
Okay. Where are
from
you?
inside the heart.
So where exactly are you when this is happening?
So depending on the lab setup, we're either in the EP lab or we're in what is called a control room, which is like just outside of the EP lab behind like glass and windows.
Wow. So, I want to know, when you wanted this position, how does it compare to what you thought it would be to what it actually is?
Man, it's so, it almost sounds like cliche or naive, but like, so when I read the position, mind you, when I started this hunt and I decided like medical device, out of all the million categories, I came across this position and it literally like ticked everything that I was like hoping for when thinking like, what do I do next?
Mhm.
So, but now it's even more so because I wanted something that medical device, right? But I wanted something that was hands-on as possible. And I could not have asked for something more hands-on because it's like a video game on steroids. I'm like creating this map and seeing it come to life and then, guiding the doctor with his catheters while he's manipulating them and advising on where to make lesions. It's extremely rewarding because like from start to finish, and there's a little bit of patient interaction too. And I come
Really?
from,
Okay.
yeah. So when the patient comes in, they're conscious and while we're not allowed to administer any treatment, of course, but we have to place like our location patches that are part of our system. So we get to say hi, have a little banter here and there. And I love that because it marries so well, like my passion for healthcare, but my geeky side of technology and has just elevated that. So it's everything that I could have hoped.
That is amazing. Okay. So let's dial it back. You're a graduate from the Medical Sales Career Builder program. How did you find us? Everybody here needs to hear the journey of how you found us and then how, of course, you went through our program and got into this position you are today. Talk to us a little bit about that. How'd you find us?
So I was, I worked in internal medicine. Well, I managed a lab in internal medicine, and we had pharma reps come through, and I just kind of started getting curious about as to what they did. And I met a woman that worked for Janssen, which is the pharma company of Johnson Johnson, and she just told me about her world, right? And then I was like, well, I don't know if that's exactly what I'd like to do. And she's like, Johnson and Johnson has a million other techie things that you can look into, and they'd be right up your alley. And I was like, all right. So and then in our conversations, she would mention like med device or something. She'd be like, oh, it's different from med device, but she would never like really go into detail. So I was like, what is there's med device? Like, what is that? And so I was like, all right, Google, what's med device? And then I started reading. And then I went on Spotify and I started typing med device, and boom, boom, here comes your nice blue icon and your white shirt. And I was like, medical, like, oh gosh, what it's called, a medical sales podcast. And I was like, oh, that's exactly what I'm looking for. What is this? And hours into your episodes, I was like, wow. I was like, this is really cool. So then So that's how I found your podcast. And I'd listened to all of these awesome stories of people that didn't come from sales or people that, had all these different ways in. And it took a few episodes. And then there's that, like, if you like what you heard and you're curious, and I'm like, I am. And so I was like, I need to know because my Janssen rep friend, she told me, she's like, I'll tell you one thing. She's like, it's hard. She's like, it's hard to get into, like, no matter how much you prepare. She's like, it's hard to get into. Some people take a couple years. She's like, I didn't get in at first. And I thought maybe she was exaggerating. But then I was listening to all of these podcast episodes and I'm like, this is really tough to get into, apparently. So I was like, oh, how can I best prepare myself? Because I'm not about to waste all this time getting rejected. So I hit you guys up.
Wow, and the rest is history. Okay.
Yes.
So let's jump ahead. I want to know, what is it, if you can just capture it in a nutshell, what is it that you got out of this program that got you into this opportunity? Because I remember you telling me that this is a bit of an exclusive opportunity and the people that you normally are working with don't necessarily have your background. Talk to us a little bit about that.
Yeah. So interestingly, a lot of the people in this position, obviously, some of the more like the very sales and contractual positions do come from like sales backgrounds and things like that. But the clinical specialist role usually comes from like people who get recruited who have like biomedical engineering backgrounds or came from electrophysiology and then decided to transition into instead of the clinical side, the manufacturer side, and or went through like an ATI program. And so I started seeing it because one of the things we learn in your program is to use LinkedIn. I had not touched LinkedIn since like this professional development class I had in like my sophomore year of college. And so I was like, oh, dust this off. So I was like, what is this? And then your program really like taught us how to like search. So I was searching these people and I was like, oh my gosh, like a lot of the people that I see, like, oh, I just got this job, come from way different backgrounds. So I was like, what can I do to like prove that I can do it? Because I'm like reading and I'm like, I can learn this. I know I can. And like I know this is where I want to be. And what your program did so like beautifully is really like helped me like gather my thoughts and like essentially take a step back at like my career or, up until that point and say yeah. And like, essentially like I learned how to package it, right? Like, and present it in a way that was useful and transferable. Cause I'd be like, well, I worked in a lab. How do I say like, I was like, I did do these things and you guys just really helped me bring that like assurance and that confidence out to be able to express why I knew that I'd be good for the roles that I was going after.
That's beautiful. That's beautiful. I love it. So, if you're talking to someone this, it's so important, right? Because for this episode is serving two purposes. One, puts on notice your field, your specialty that is so dynamic, nuanced, and is really demanding. And you were able to deliver in this space, not having the exact background as your counterparts you're working with today. And then two, to showcase how this program can get you there. If you were to share with someone that's maybe thinking about stepping into medical sales and maybe they're even thinking about doing this program, talk to us a little bit about what you would share with them, why they should consider it and what it might do.
So I'm a big proponent of, as cliche as it sounds, right, is like work smarter, not harder whenever possible, right? Because this is a long journey. It can be long and it's demanding and there's so much. I mean, side note, interviewing for these roles is unlike any other kind of role that I've ever gone after. And I come from management and even at the management level, like it's never been this rigorous. And so I think like if someone just really wants to know, like, okay, what do I need to do? You don't give us the answers, but you help us you give us all of the tools, right? And so if you want to know, like, okay, how do I assess my background? Like, how do I like comb through it and say like, well, like this job is asking for this, but I never did that. But you guys give us, this program gives us the tools to be like, just because you're not like, just because it doesn't say it verbatim the way it's listed, doesn't mean that you don't have experience doing that kind of thing. It's just doing it, but just in a different environment. For example, I was like, I don't have selling experience, but I was in charge of vaccines, and you told me, or like Keila, when you convince patients like at the benefit of the vaccine, like that's you just sold. And I'm like, that's true, because that's, like that's a sale essentially. But also like with me at least, like I knew I had a decent like career history. I had various jobs in healthcare, but like I guess without being too like emotional, like imposter syndrome was always like a big thing for me. So, especially for people that might not suffer, but like struggle with that, right? Like, oh no, like, yeah, I did this, but it's not like that. Like I could never do that. This program and your coaches, like just really helped. I mean, it took some extra hammering with me, but like it just really helped be like, no, Keila, like, yes, you did do this. Like it's right there. And I'm like, really? That's the same? Like, but no, they're not gonna. And then it'd be like, stop, Keila. Like just cool it and just I guess like for me personally, like I really learned how to like own my value and like own like what I bring. And coming from like a very different background, like, yeah, this isn't my first job out of college. I'm not a biomedical engineer, but I come from this very different like background in healthcare. And which actually kind of served to my benefit, like being able to draw from those experiences made me valuable. Right. So it doesn't matter like what jobs you've had, like whether they're related or not, this program really helps you to just dig deep and like assess and find all the little hidden gems that you have and be able to present them like in a treasure chest, like, ta-da, like this is why you want me. And also like the confidence in just expressing yourself, because again, I'm sure people can relate to this. I always thought that like speaking of like things that you did well in your jobs or something was like being arrogant or like braggy, and like no one cares, like, or so many other things that I do, I'd be like, yeah, but that was little, that was nothing. But like your coaches in the program just really helped me be like, no, this is an accomplishment, like, and I should not feel like I'm bragging when I'm telling somebody like, no, this is my proudest moment because this is what I did, and this is what came from it. And it was awesome because, I had this result, and it's okay to be proud of those things. And so yeah, I feel like that. And then of course, just interview preparation. I mean, that's like, I've interviewed for countless jobs, but like, you just always get nervous. At least I always do. And even throughout the process, I was still sweating. But at least from like here up, I was like, hello. And just learning, like, again, like, this program isn't a cheat code or anything like that, or like answers and things like that is not like canned or rehearsed or staged. And that's what I loved about the program. So I was like, well, I don't want to sound like a robot just because I want this role. And actually when I would sound robotic, you guys would be like, like sound genuine, like be yourself, like, and I'd be like, really? But I get silly sometimes, and I'm like weird, and it's like, just be weird, but like know how to communicate while showing your weird like mannerisms. And I'm like, okay. And yeah, and so like really coming from this background, I mean, from this program, especially like with my background, right? Like it wasn't about like talking about like what I've done, but it was more like talking about like why what I've done has made me and prepared me to go after this role and why this would benefit, and just being able to package that like nicely in a way that they're like, yeah, like interesting background and you're clearly prepared. And that's another thing. There's things that with like going after med device that like no one tells you, no matter how many jobs or interviews you've had, like there's all the little nuances though. Like how was I supposed to know that like it's best if you've connected with people that work at the industry, even if they're not local to the team you're applying for, but little things like that, like, oh, you've gone out of your way to like learn more about the company and beyond just like what's on your company website, right? And so that like little things like that, and like those searching tools, because thanks to your program, I became an A-class LinkedIn stalker. And it's what essentially like helped me with all of the positions that I was interviewing for at the time, before I accepted my offer. It was all because I like stalked people on LinkedIn and I was like, talk to me. And that's really what allowed me to get in front of people because, again, like you said, like coming from like a nuanced kind of area, like working in EP, it's not like very broadly like broadcasted or things like that. And from the people I've met along the way there, they all kind of knew somebody that was already working for, J&J and kind of got in that way or worked in EP. But like coming from completely left field and they're like, oh, really? Through LinkedIn? And I'm like, yeah.
And that's it. I love that you bring that up because one thing that we really champion is we teach you how to do things effectively. And we teach you how to utilize these resources in the most powerful way possible that actually gets you into opportunities you probably wouldn't have experienced otherwise. And I actually want to ask, how do you be, and share this with the audience, because I'm sure everyone's wondering, what do you think this would have looked like if the program wasn't there? Do you think you would have been able to get this opportunity?
No way. Absolutely not. At least this role in particular, for sure, because I did do, just to be proactive while I was in the program, I was like, all right, let me submit my little application on their website. And it sat there while I was trying to like connect to people and everything. And it sat there and not even a rejection, nothing, it just sat there. And I think I would have still been sitting there. Like, honestly, I think I would have still been sitting there. And actually, one of the people I connected with, he was really kind because he had actually just started the program. I mean, the training program at Biosense. And I asked him, I was like, so what was your experience like? And he's like, because I was like, I applied, I sent my, application. He's like, oh, it's not going to move. He's like, mine was sitting on there for 5 months. And it wasn't until like, I think he had a friend that worked and then he got like introduced or something like that and kind of got the ball rolling. And so, and that was just reinforcing what this program tells you. Like you need to like utilize LinkedIn and just weaponize it, like make it your secret weapon to get in front of like what you need to do, like to get there. And it was like that at the other 2 companies too, that I was interviewing at, and I applied to their sites, but the moment I just kept stalking people until finally I got a conversation with somebody, that would initiate then the interview process.
Exactly. We give you all the deliverables so you're packaged the right way. We teach you how to have those conversations. And then, of course, like you're explaining, we show you how to actually get to the right people to conduct those conversations, show them your deliverables, and get into the interview process, and then blow them away in the interview process. One thing I like to say is that we sell confidence, right? You come to the program, and, okay, either you're getting interviews and you're not landing them, or you're not getting interviews, or like you said, you have no idea where to start. And then after our program, you are like, I know exactly where I'm going, what I'm going to do, and how I'm going to get there. So that's wonderful.
Yeah.
Keila, it's wonderful to have you on this episode today. And you're still in the program. You still come by and kind of hang out with
I'm attached.
With new students. Yeah, you're attached. But, I think it's wonderful for you to come by because you always inspire the people that were one time in your shoes. If there's anything else you'd like to share with the audience, please share.
I really think this is, I mean, I'm a big proponent of, like making the right investments, right? And being smart with your investment, obviously. And I think in life, right? Like to move ahead, like you have to invest something, whether it's time, whether it's monetary, whatever, you're making an investment. And again, like working smarter, not harder. We're adults, we're busy. Like just make that investment to like just grow professionally because side note, aside from getting this role, I think just personally, like I grew as a person. Like this was an investment personally to me because like I previously mentioned, I didn't know how to, or I was shy to communicate my strengths because I thought of them as like bragging or something like, and it's not that, right? Um, and like, sure, if you're going to invest in having someone like write your resume, which is pricey, like why not make a more robust like investment that's like holistic? It's not just like, okay, here's your data, here's your resume. I have no idea who you are. Like, good luck finding a job. It's more like, no, like it's an investment, but at the same time, like the return is like you get coaching, you learn to discover things about yourself along the way, and that will serve you professionally later on. Like these skills of being able to communicate effectively or knowing how to communicate is essential, right? So I feel like, I don't know, like don't, I mean, if you have the time to waste and just sit around and having those those resumes floating in la la land on talent websites, like, I mean, if you have the time to waste, that's fine. But if you're an adult and you got bills to pay, like, then you just want to make sure, like, okay, how can I be best prepared to do what I need to do for that next step or like to elevate my life to the next level? Like, this program was everything that I needed to do that.
That is fantastic, Keila. It was awesome having you on the show today.
Thank you.
So just to get a little bit about Keila, do you have a family, Keila? How is your life set up?
So I have a husband and then I have a four-legged son. His name is Pilot.
Pilot's his name?
Yes.
How old?
Yes.
How old?
Oh my gosh, he's an old man. He's 9, I think.
Well, that's
Yeah.
that's an adult, a
Yeah.
mature adult, but not an old man quite yet.
He is. He is. It's funny because in dog years, I'm like, oh, you're older than both of us, technically, but we
What
treat
type
you
of
like a baby.
what type of dog is Pilot?
He's a Shih Tzu.
Shih Tzu. Oh, so are those
Yes.
the noisy ones or are those the quiet, cute ones? Remind me.
They're supposed to be quiet and cute, but mine's more like grumpy and cute. He just has this like resting, like grumpy face, but he
That
looks like an Ewok, and so it's
Oh,
adorable.
that is too cute. With this career path you're in, would you say that the work-life balance is there, or would you say that you've had to adjust as far as that's concerned?
It's been an adjustment. But I feel like this path, again, like about it ticking all my dream job options. I mean, there's always some sacrifice, right, that you have to make if you want to like move forward and things. But overall, this path and EP is nice because it is elective, so there is no on call, which is great. Which is one of the things it was just not sustainable for me. And so like right now training is brutal, right? So there's not much work-life balance. It's like they're like, no, don't work on the weekends, just study your mouse. Like, there's no not studying. What do you mean? So right now, like my life is consumed of modules and trainings and being in the field and like, but as soon as that's over, there is more of a work-life balance. But again, it's healthcare. So like you have to be okay with like schedules being changed, cases being added on or canceled, and then be like, oh, I drove all the way here for nothing. But it has a good, I think it has a good work-life balance for like the reward you get.
Beautiful.
And
And then the last thing I'll ask, What would you, for those that are listening and saying, wow, this field that Keila's in, I'm curious. And or maybe they're listening, they're saying, you know what, I have a similar background to Keila. I need to explore this. What would you say maybe the top three things that a person should definitely check themselves that they have to be able to perform, or even forget perform, just do this kind of role?
So I think you have to be willing to, I guess it's going to be a huge like learning curve, and every job is going to say that. But in my experience, like electrophysiology is very complicated. And I think you have to be willing to learn something completely new, and be curious about it, right? Like, because it can be overwhelming, honestly, like even, and you'll know actually if this position's cut out for you, if when you start studying and looking into the equipment and then you're just like, okay, my brain hurts, I don't think I want to do this. Then it's like, okay, maybe you should look somewhere else. But if you're looking at this technology and it's like, I don't know what I'm looking at, but it looks really interesting and I want to learn more, which was my case. And so then like hours later, I'd be like, what? And because again, like I've never studied as much as I've studied for a job like I did here. Like, I mean, just for interviews, like they'd be like, so what do you know about AP? Then I'm like, catheters, AFib. But even that, because everyone knows like it's its own little world. So just being able to like demonstrate that you've already studied up on things. You don't have to be an expert by no means. But just know, like if you're like, well, actually, I don't really know anything. Not a good fit, because this will make you work for sure. Your brain.
So you definitely have to have the interest and
Yes.
have the mindset to handle the complex information. Give us two more.
I'd say, I kind of alluded to it earlier. Like you have to be okay with variability, and having a good sense of emotional intelligence, or just being able to like recognize and regulate emotions, because you are like during the whole procedure, you're interfacing with an entire staff, with EP docs. And so being able to like engage and mold to situations and not losing your cool. So, yeah. So, okay. So yes, being willing to learn something, and spend the time learning and being interested in it. Right. Also, yeah, being okay with variability, like subject schedules changing. And also, yeah, and emotional intelligence, just understanding like how to communicate, noticing other people's like, emotions, behaviors, and learning how to just kind of be a chameleon in the room, because you're not just a fly on the wall in these cases. You are 100% on from the moment the patient gets in to the moment the patient's being woken up out of anesthesia. So,
wow. Well, Keila, thank you for sharing with us. We're going to switch gears a little bit. Are you ready for the lightning round?
Drum roll. Am I ready?
Drum roll, please. All right. So first, you have 10 seconds to answer these questions. I'm going to ask you four questions. First question: what is the best book you have read in the last 6 months?
So I haven't had time to read in the last 6 months, other than like electrophysiology books. Sure. But actually, the Start With Why book by Simon Sinek, that was part of your curriculum, honestly was like one of the best books I've read, like for leisure, if I have to like expand that window to a year, because it just really like reassured things that were already like personal philosophies of mine. So it's awesome.
Beautiful. Best movie or TV show you've seen in the last 6 months?
Again, not much of that happening lately. No, but I did watch The Last of Us on HBO.
Okay.
Love it. That was a good
Okay.
show.
So you recommend it?
I do. I do. I do. If you played the video game though, like, I don't know. I think it was great adaptation to the video game, but
I don't know either,
just like,
but I believe you. Last best meal you've had, and it could be a restaurant with the meal in the last 6 months.
okay. So I've been heading down to Fort Lauderdale for my trainings and when I'm in the field, and I ate at this place called Moon Thai a couple times now, and they have the best sushi rolls. Like their presentation, it's just perfect, and like the flavors and the like textures, it's just
Fort Lauderdale, Florida, Moon Thai.
yes.
Got to get the sushi rolls.
Yes.
Any particular sushi roll to get?
Oh gosh, I don't know. I've had what is it called? It's not a dynamite roll. It's oh man, I can't remember what it's called. It's like I can't remember what it's called, but it was so good because it was like shrimp tempura, but I've never had a sushi roll that has like little slivers like mango slices on it, and I thought that was gonna be weird, but it was delicious. It was like spicy mayo, and it had like tobiko and like mango. It was so good. It was so
Okay,
good.
she's gonna find out, everyone, and it will be in the show notes. The sushi roll to try at Moon Thai. And then the last question: what is the best experience you've had in the last 6 months?
Obviously, landing my dream job.
Amen.
It's been the best experience.
Amen to that. Keila, we can't wait to see the amazing things you do in this space. And we're so glad that you did acquire your dream job and you did it through our program. Thank you for being on the show today.
Thank you, Samuel.
Absolutely.
And that was Keila Resto. What I loved about her story is how she discovered a very nuanced space. She saw that she had the wherewithal to figure out how to make that nuanced space work for her and provide value within that nuanced space. And then she utilized our program to become someone that's qualified to be in that space, showcase her skill set, get the position, and truly dive into something that she absolutely loves and live her life out as a dream, in her dream job. You know, that is awesome, right? It's a beautiful thing to listen to. It's a beautiful thing to hear. And it's a wonderful thing to consider for ourselves. You know what? I loved her story. Could that be me? Maybe I'm next. So whether you're out there and you've been contemplating medical sales, not really knowing where to start, but wanting to get in, or whether you're out there and you've been applying day in, day out, applying, nothing. Or maybe you're someone that's been getting interviews, and for whatever reason that you can't seem to grasp, you're not able to close them. If this is you, it's time to stop wondering, pondering, thinking, and it's time to start acting. Take an action. Visit evolveyoursuccess.com and get in touch with a team that can work to get you where you want to go and give you all the confidence to show up like you've never shown up before and get these positions. And if you're listening to this podcast, then please feel free to leave us a review. Let us know how you feel about what you're hearing. And we're going to take the best reviews and we're going to be broadcasting. So as long as you're listening, you'll know who you are. But please, whether it be Apple, whether it be Spotify, leave a review. We'll get wind of it. We'll start talking about them on the show. As always, we do our best to bring you guests that are doing things, wonderful things in the medical sales space and that are getting traction to get into and getting into the medical sales space. So make sure you tune in next week for another episode of the Medical Sales Podcast. I hope you enjoyed today's episode. And remember, I have a couple programs that show you exactly how to break into the medical sales industry, become a top-performing medical sales professional, and also how to masterfully navigate your career to executive-level leadership. Check out these programs and learn more at evolveyoursuccess.com. Stay tuned for more awesome content with amazing interviews.